Could a virus that has already killed hundreds in South Asia be on the verge of spreading beyond India's borders? The Nipah virus, a deadly pathogen with a fatality rate ranging from 40 to 75%, has been confirmed in West Bengal, raising concerns across Asia. With cases detected in healthcare workers and tens of thousands potentially exposed, neighboring countries are rushing to strengthen airport screenings and border checks. This video will unpack what Nipah is, why it matters now, and the global stakes if containment fails. The implications of a Nipah outbreak extend far beyond the 2 confirmed cases. If the virus spreads undetected, it could overwhelm healthcare systems in densely populated regions, disrupt travel and trade, and trigger emergency responses across multiple countries. Conversely, effective containment would prevent a regional crisis but requires rigorous surveillance, public awareness, and international cooperation. In either case, the situation highlights the vulnerabilities in global epidemic preparedness, the interconnection of countries in South Asia, and the high stakes of early intervention. The Nipah virus was first identified in 1998 among pig farmers in Malaysia, spreading to Singapore and killing over 100 people while prompting the culling of 1 million pigs. Named after the village where it first emerged, Nipah is a zoonotic virus, transmitted from animals such as pigs and fruit bats to humans, and capable of limited human-to-human transmission. It is now listed by the World Health Organization among the top 10 priority pathogens due to its epidemic potential, alongside viruses like COVID-19 and Zika. The incubation period ranges from 4 to 14 days, and symptoms can be highly variable. Initial signs include fever, headache, muscle pain, vomiting, and sore throat. In more severe cases, infection can lead to altered consciousness, pneumonia, and fatal encephalitis. South Asia has repeatedly experienced outbreaks. Bangladesh has reported over 100 deaths from Nipah since 2001, with recurrent incidents tied to exposure to bats and contaminated food. India has seen previous outbreaks in West Bengal in 2001 and 2007, and in Kerala in 2018 and 2023, where fatality rates were extraordinarily high, reaching 17 of 19 cases in one cluster. These historical patterns underscore the virus's persistence in the region and its ability to cross geographic and species boundaries, posing a continuing threat to public health. The current situation began in December 2025, when 2 cases were confirmed in West Bengal among healthcare workers. Indian authorities immediately traced and tested 196 contacts, all of whom were found to be asymptomatic. While the Health Ministry emphasized that the situation is under constant monitoring and that public health measures are in place, the outbreak has prompted neighboring countries to act preemptively. Thailand has implemented screenings at 3 major airports, receiving flights from West Bengal, requiring passengers to submit health declarations, and reinforcing monitoring at popular tourist sites. Nepal has initiated screening protocols at Kathmandu Airport and at land borders with India. Meanwhile, Taiwan is considering designating Nipah as a Category 5 disease, requiring immediate reporting and strict control measures for emerging pathogens. The stakes of this outbreak are magnified by the virus's lethality and the absence of approved vaccines or treatments. In a densely populated state like West Bengal, with over 90 million residents, even a small cluster could escalate rapidly. Travel and trade restrictions, if applied, could ripple across Asia, affecting supply chains and tourism. Additionally, the virus's spread would test the capacity of regional healthcare systems, which vary widely in infrastructure, emergency preparedness, and resource availability. 2 potential scenarios illustrate the stakes. In one, containment measures succeed. Infected individuals are isolated, contacts are monitored, and the virus does not spread beyond a limited cluster. In this case, authorities would demonstrate effective epidemic management, setting a precedent for regional cooperation and early intervention. Neighboring countries having enhanced surveillance would prevent importation of cases, reducing the risk of a multi-country outbreak. In the second scenario, containment fails. Nipah spreads beyond West Bengal, potentially reaching major population centers and neighboring nations. Such an outcome could trigger mass quarantines, strain healthcare systems, and disrupt regional economies. The risk of international concern would escalate, prompting WHO and other agencies to mobilize emergency support and possibly restricting cross-border movement. This outbreak highlights the role of animal-human interaction in viral emergence. Fruit bats are considered natural hosts for Nipah, and exposure occurs through consumption of contaminated food or close proximity to livestock. Previous outbreaks have shown that even minor lapses in biosecurity in hospitals or farms can initiate chains of transmission, underlining the importance of public awareness campaigns and strict hygiene protocols. Regional governments, in collaboration with health authorities, are now focused on early detection and rapid isolation to prevent person-to-person spread. Geopolitically, this situation emphasizes the need for coordinated international health governance. Thailand, Nepal, and Taiwan are already strengthening screening, demonstrating the cross-border nature of infectious disease threats. Effective containment relies not only on domestic public health measures, but also on timely information sharing, resource allocation, and regional coordination. Countries with close travel and trade ties to India have a vested interest in preventing the virus from crossing borders, making Nipah an immediate concern for regional security and stability. Economic considerations are also significant. Past outbreaks have shown that Nipah can devastate local agriculture, disrupt trade, and generate public fear that affects tourism. The 1998 Malaysian outbreak led to the culling of 1 million pigs and severe losses for farmers, while outbreaks in Bangladesh and India have similarly strained healthcare budgets. The potential economic fallout from an uncontained outbreak in West Bengal could reach billions of dollars, factoring in lost productivity, medical costs, and preventive measures in neighboring countries. The broader lesson is that even highly localized outbreaks can have global implications in a hyper-connected world. Regional travel, migration, and trade make it impossible to contain emerging pathogens to a single geographic area without swift, coordinated action. The current outbreak also underscores the critical importance of research on antiviral treatments and vaccines for priority pathogens identified by WHO, as the absence of approved interventions significantly raises stakes for public health authorities. In conclusion, the Nipah virus outbreak in West Bengal is a reminder of the persistent threats posed by emerging infectious diseases.